Morning. Thank you, sir. So I'm going to talk about visual acuity improvement by dichoptic therapy in amblyopia. So amblyopia, which is a visual developmental disorder where reduced best corrected visual acuity in one or both eyes in absence of ocular pathology. And we know patching the healthy eye after refractive correction is the conventional standard treatment with good results in children below 3 to 4 years. Often, in the older child, prolonged periods of patching yields little improvement, and compliance is a major factor precluding its use. A new approach based on the binocular origin of amblyopia has shown variable results. In dichoptic training, each eye receives different images separately, and to complete a task, both eyes are forced to work together. And Binox is a cloud-based software for the assessment and treatment using this principle. It allows remote conduct of diagnostic tests and therapy under supervision. So the aim and objectives are to evaluate the efficacy of dichoptic therapy in the management of an isometropic and combined mechanism, that is strabismic and refractive amblyopia, and to study the improvement of visual acuity and binocular functions. So a prospective observational study was done among anisometropic and combined mechanism amblyopic patients who did not improve with glasses and patching, and underwent dichoptic therapy with Binox. From February 2023 to February 2024 in our department in Kerala, in South India. Pathological myopia, previous intraocular surgery, development anomalies and deviation more than 10 prisms were excluded after a detailed history and examination of anterior and posterior segment and looking for binocular vision and stereopsis with TNO. Glasses were given and patching done. In case of any deviation less than 10 prisms, prism correction and assessment of binocular vision was done again. And this Binox dichoptic therapy methodology was a diagnostic assessment is done with the Binox software, with visual acuity, binocular single vision, and stereopsis done with the software. And any amount of deviation also was noted. Binox Ambligo program is an AI-based vision therapy based on dichoptic principle. Contrast-adjusted images are given to both eyes and with red and blue goggles. Normal eye receives lower contrast image compared to amblyopic eye. The contrast in non-amblyopic eye is slowly increased until they are equal, thus removing suppression of the weaker eye. It consists of 40 sessions, 40 minutes each, 5 days per week for 6 weeks, a total of 30 sessions. So after adjusting calibration, initial assessment was done after 2 weeks of therapy, follow-up at 4 weeks and at the end of the therapy. And best corrected visual acuity and stereopsis was done. Statistical analysis was done. There were 28 patients, majority belonged to the pediatric age group, and the majority were anisometropic amblyopes, combined mechanism, and one was accommodative esotropia. 2 had strabismus surgery. Hypermetropia were 7, and hypermetropia with astigmatism 10. This is the statistics. And visual acuity improvement was seen after therapy. With paired t-test, it was statistically significant. There was an improvement of 0.05 in the non-amblyopic eye as well. And stereopsis also improved. There is a definite improvement with the p-value 0.005, and it improved in participants who had a minimum stereopsis. There was significant improvement of vision, even which maintained for 3 months, and in binocular vision also. In a similar study by Abdul et al. In 161 patients, the refractive amblyopia in amblyopic mean change was 0.39 logmar, and with the Mazard course, it was 0.28 logmar. In our study, it was 0.118. There is definitely an improvement in stereopsis as well. The so stereopsis has improved in those patients whom at least minimum was there. And contrary to this, a PEDIG study showed that there was no improvement with binocular stimulation by Digrush iPad program. So to conclude, dichoptic therapy is a platform effective in an isometropic and combined mechanism even in adults, which was maintained, and stereopsis also was maintained for 3 months or more. And it is good in pediatric and adult age groups. Thank you.
Thank you, ma'am, for touching upon that topic on amblyopia. Like occlusion therapy remains the mainstay, but compliance has always been an issue regarding that. So for these baby bloomers and Gen Y, Gen Zs, this kinds of technologies like the app-based or computer screen-based where they actually interact, that I think is a good one for compliance as well. Ma'am, like what would be the protocol? Like, do we straight away go ahead with Binox, or first you go
No.
on with patching and then follow it up with?
Actually, PEDIC showed that those who already have had patching did not improve with binocular therapy, but we started Binox after waiting for any improvement with patching, at least for 6 months.
So
So,
do they both go simultaneously as well? Do we
no,
recommend? No.
once we started Binox treatment, there was no patching along with it.
Age group, like when do you recommend it? Like before 8 years or 7 years? Any
No,
cutoff?
we had
Beyond 8 years?
up to 29,
Up to,
30, we have
right.
had patients who improved
Oh.
with treatment. It's an ongoing, actually, we have only taken the 29 patients, but we have ongoing good results with the binocular therapy.
Results have been excellent. Like the follow-up duration, ma'am.
We
Three
have
months you
1
have
year.
mentioned of
We
one
have
year,
1 year,
right?
yes.
That is good one, sir.
So, ma'am, basically what we're doing here is we've already tried patching. Those who are resistant to patching,
Yes.
not improving, they move to Binox.
Yes.
And
Those who are willing, not every patient.
not every
Yeah.
patient. So those who can afford to move to that, they move to that. And we have 25 is an isometropia and 3 is combined. So basically what we're looking at is an isometropia, it's doing a good job.
Yes.
And you are saying that it is also covering an older age group.
Yes.
So how many patients in the older age group are we looking at?
Actually, 3 patients only, but we are taking up more and more patients because they come after recruitment processes when they are declined with the in the military or in
Yeah,
some.
actually,
Yeah.
what's happening with the dichoptics is that uh, there is a multitude of interventions. So it's always a challenge. We would be looking at results from your center because you would be following one particular technique, and uh, it's just like lot of things, lot of patients, different types of patients, different groups of patients, different groups of therapies.
Yeah. We
So.
had been very slow in going because we had a thesis protocol 2 years back when we had 16 patients. Very slowly we started, but when we saw good results, we've been recruiting the older age group also more
Yeah, we'll
nowadays.
be looking forward to further results from you. Thank you so much, ma'am.
Thank